Hello, my name is Adin Gates. I'm in Professor Rizzler's Bio 139 online course at Sky CTC. I just finished my research paper and uploaded it about POTS, or postural orthostatic tachycardia syndrome. My mother has this. I have a few friends that have it. I'm not very familiar with it, but I'm somewhat aware of the gist of it. POTS is the main thing that they characterize POTS as is going from a lying down or sitting position to a standing position in really a short amount of time. It could be longer as well, and feeling fatigued, feeling dizzy, straining yourself, having some syncope, or experiencing some possibilities of syncope, such like that. But many people feel shaky, lightheaded, they feel more physical heart palpitations, and again, experiencing syncope. Syncope is passing out. Again, fatigue is a major thing. It makes you feel like sick but tired. Your muscles feel weak. You feel bedridden. But this can come in a wave. That's why there's so many different symptoms, like shortness of breath, headaches, nausea, trouble sleeping, too hot or cold. There's so many different symptoms of POTS, which makes it very hard to diagnose. And again, it can come in different forms or fashions, especially with how young you are, how much exercise you're getting, any such thing like that, even family history. There are so many things. Again, there's another thing called brain fog. It's more like aphasia. I work in a hospital on a neurological and stroke unit. I've been working there for a while as a student nurse, and aphasia is difficulty like getting your thoughts out. It's difficulty thinking, but at the same time speaking. It's not entirely dysphagia, okay? But it's in the same sense of it. It's the mental part of it, and that's really what brain fog is. It's temporary aphasia, and it's scary to the person that's having it, and that's also put into thought whenever doctors are diagnosing POTS. It's very unpredictable, and it can change at any time for any person, even if you have the same symptoms for a long time. But causes, there's not any known causes for POTS, like definitive ones, but there are things that doctors and researchers have found to kind of contribute or make POTS more active. So like nerves or neurons that control or regulate blood flow, blood volume in your cardio, or your circulatory system. There's also, let me see here, hypovolemia is what that's called, low blood volume. But also people with too much adrenaline standing up, they get abnormal or hypernormal waves of adrenaline when they're standing up, or just have a normal amount or an abnormal amount already in their system. POTS can start after surgery, major illnesses, pregnancy, any type of life-threatening event. A major cause of this, or that I've seen that it really doesn't make it any better but makes it worse, is stress, physical stress. And that's again why after pregnancy, after having children, a lot of women, I see it more in women. I'm not a doctor, don't quote me on that, but everybody I know has it that are women, and it's just more common in them, I assume. But it can also run in families. I do not have it. I don't know anybody that does, but I've seen some research over how it does pass down or go down the lineage in your family. It doesn't have to be the next generation. It could be whatever. But there's so many different things that can contribute to POTS and make it where you have it or you could be diagnosed with it. It's just not a good syndrome to have, especially because of how unpredictable it is. But for diagnostic testing, okay, so since POTS has so many different symptoms or issues that can correlate with other diseases or illnesses, it's very hard to diagnose. I've said that a bazillion times already. But they usually, doctors do, I remember this, it's called a tilt table test. And it's where they raise the table up, you're laying supine on it, which means on your back, and you tilt the table up. And while they're doing that, it's going very slow as well. It's not very quickly. They may do it very quickly at first or after, just to determine or differentiate the results. But they measure your blood pressure, your orthostatics pretty much, and your heart rate as you go up. And if you increase, I don't want to quote the thing, or I don't really remember. I didn't want to write word for word, but if it's above 30 beats per minute in the span of them raising you up, because it's not very quickly, but if it's more than 30 beats per minute, whenever they start raising you up from here to here, you usually qualify for POTS. And that's, again, the main thing that they've been using for in that sense. But they also might use an EKG on you to determine if there's any pre-existing heart conditions that may alter the outcome, or the other symptoms that you might have that might explain that for them. You know what I mean? But yeah, they have different tests they can run. They're not the best, you know, they're not very definitive or very concise, but they try to be. Since it's so vague, it's very difficult. Treatment, there's not a cure for POTS, but there's things that you can manage in your life. Like with your symptoms, increasing your salt and water intake is very good. You want to keep your body more fluid, have more sodium in your body. It keeps you more awake, more mentally aware, if you will. It genuinely does. Let's see here. It also helps with the blood pressure, which is, again, very important. Your systolic and diastolic pressures literally is how your body and your heart is pumping. And if it's very high, very low, it's going to mess you up. Compression stockings as well. People have some edema in their legs sometimes when they have POTS, which means they're not getting up enough, or they're just not having good, adequate blood flow. Compression stockings can squeeze your legs tight, so when you are walking around, it promotes blood flow a lot better. And it's very good. It also prevents deep vein thrombosis, which is very deep blood clots in your legs, which is not good. Medications like beta blockers, or which are vasoconstrictors, which will slow your heart rate but also increase blood flow. It works, like, I don't remember the name, but I have it on my paper. But they can also help with that. And again, not all medications will be working everybody. They will differ between person to person, allergies, anything like that. But diet as well. Diet and more passive things, not necessarily medications, are more important, just because those are things that are easier that you can do. Again, having more water and salt in your body, eating things with more salt. I don't remember the amounts, but it increases your blood volume, which is good. I put down here, drinking 2 to 3 liters a day is very good for water intake, which is about the normal amount if you want to convert it to imperial. But metric is just so much easier, and I'm just more around metric system. But smaller meals that have more protein, that have less sugars, less carbohydrates, less fats, stuff like that is also good for you. Not eating, I don't want to say not eating 3 meals a day, but not eating as much in your 3 meals a day, if you will. Again, try to stay away from alcohol as well, which is, it makes your blood vessels more relaxed, which is not good for you. Alcohol in general is not good. You should not drink. But caffeine and sugar as well, no goes. Caffeine raises everything. It's not good for you. No dark chocolate, not very much coffee, stuff like that, and you will be okay, at least managing your diet. And for the prognosis, let's see here. The outlook varies, but with younger people that are more like out and they exercise a lot, is very good. They have more chances to control their outcomes and their, how should I say this, their life. Older people that can't do it as much is a lot harder. Getting to a doctor soon is best, and trying to get them to diagnose it so you can go from there and learn from that. It's not life-threatening, but it can lead to events with, like, syncope, passing out. You could pass out in a bad spot, but pretty much that's it. Yeah, just try to eat healthier. Oh, lights went out. Eat healthier and stay active.